Erectile dysfunction is psychological. However, this can be a sign of current or future heart problems. Here to talk to us about how ED can be an early warning sign for heart disease or other health issues is Dr. David Crawley, a urologist at Hartford HealthCare's Tallwood Urology and Kidney Institute. Good afternoon, doctor. Thanks for being with us.
Hi, Lisa. Thanks for having me on. How are you?
I'm well. Thank you for being here. So what kinds of health issues should men seek medical evaluation for?
Well, I think first I would just say that anyone who's experiencing chest pain or shortness of breath really should seek immediate medical care at an emergency room. But what I think we'll get into a little today are some of the more subtle signs that something might be going on with your heart. That can be things like increased difficulty with physical activity, swelling in the legs, and I'm a urologist, and where I typically identify these men is guys coming in with sexual problems in the bedroom. So things like erectile dysfunction.
All right, what is the relationship between erectile dysfunction and heart disease?
Well, Lisa, there are many potential causes of erectile dysfunction, but we now know that erectile dysfunction can often be an early and one of the first signs of heart disease. And the reason for that is because one of the most common forms of heart disease is something called coronary artery disease. It's from a process called arteriosclerosis, where there's narrowing in the heart's arteries and decreased blood flow to the heart. And that same process occurs in the other arteries in our body, including the genitals. And because the blood vessels in the penis are smaller than vessels in other parts of the body, men may experience sexual problems as one of the first signs that there's a problem of blood flow going on in the body's blood vessels. And one other factor that is also an important point is that many of the causes of erectile dysfunction, the other causes such as diabetes, high blood pressure, smoking, low testosterone, all of these can also be risk factors for heart disease. So there's a lot of overlap in men who might have erectile dysfunction and men who also have heart disease.
Interesting.
So in my practice, we're now really evaluating all men who come in the door with sexual problems and complaints for potential heart disease and looking into those risk factors. We have a very low threshold to get a cardiologist involved and can order special testing to see if there's anything going on with the heart.
All right, what are some healthy lifestyle choices that can impact ED?
I think one of the main things that men can work on to improve their erectile dysfunction is to reduce obesity. So there's several studies that show that even a modest loss of weight can really significantly improve sexual function. In fact, up to a third of men who return to a more normal weight will have their erectile dysfunction completely resolved. So we really, in my practice, work on modifying that risk factor, reducing obesity. We work with a lot of great nutritionists and medical and surgical weight loss professionals to help with that. Other lifestyle choices that really have a big impact are blood pressure, diabetes, controlling blood pressure and diabetes, and quitting smoking, which is probably the best thing anybody can do to improve their health.
All right. And doctor, where can men or their partners turn to get more information?
Well, February is American Heart Month, and I plan on delivering a webinar next Thursday online. It's completely contact-free, online, and free. And we'll be providing a lot more information on the topics we talked about today, but really delving into those in depth. And audience members will also have the opportunity to ask questions. So you can go to hartfordhealthcare.org/Tallwood, which is the urology center, and there's more information on how to see one of us or to get signed up for that webinar, which I think will provide a lot of great information to the men watching.
All right, Hartford HealthCare, Dr. David Crawley, a urologist, thank you for the great information.